Okay, so today we have our delayed session, Infectious Disease, Global Impact, Science, Strategy, and Surveillance. And today we have our guest speaker, Dr. Timothy F. Brewer. So we are Scienceholic. We are a youth-run nonprofit, and we aim to introduce scientific concepts to teens all over the world. And we serve as a free resource, especially for students who don't have that access to STEM resources. And we also provide various opportunities for students around the world with English as their second language. And we also offer volunteer and leadership opportunities. So our guest speaker is Dr. Brewer. Dr. Brewer, would you like to introduce yourself?
Sure. So I think the most relevant points for this discussion is I'm a professor of medicine and epidemiology. That means that I both take care of patients and I focus strictly on infectious diseases, and I do research on infectious diseases. And my research focuses on the prevention and control of infectious diseases at the population level. So I'm really interested in things like how does SARS-CoV-2 happen? How do we recognize it? How do we stop it? I've done a lot of work over the years on tuberculosis. That's a particular interest of mine, particularly in Latin America and Africa. And I've had the chance to be involved with colleagues in a number of different institutions around the world doing both research and thinking about policy and surveillance.
Thank you. So at the end, for the attendees, if you have any questions, you can leave them in the chat and we will go over them at the end of the session. So first, we have a few questions about your education. Did you always know you wanted to work in global health when you were going through school? And what experience shaped your interest in global health?
Sure. So the answer is no. I didn't even know what global health was when I was in school, and global health really as a concept hadn't been defined then. Remember, I graduated high school in 1977, college in 1981, and medical school in 1985. And I would say that global health really started to come around into its own in the 1990s. Before that, there were other concepts, including international health and tropical medicine. So when I was in school, tropical medicine was probably the term most commonly used. I actually had no plan to do what I do, right? So I was a history major in college. I ended up going to medical school. I thought I was going to be an oncologist, a cancer doctor. And then I ended up during medical residency between my second and third years having the chance to spend 3 months at the Schweitzer Hospital in Lambaréné, which is in Gabon in West Africa. And that's really where I got interested in what was then known as tropical medicine and eventually became global health.
Thank you for sharing. And next, what are some meaningful experiences that helped you shape your career?
Sure. So I mentioned the one about the chance to go to the Schweitzer Hospital and be exposed to issues that I had never seen before. And that was really a transformative experience. And transformative learning is where um, it's not just the acquisition of knowledge, but your whole frame of reference changes in terms of how you think about topics and issues. Um, One of the key things in my career is mentors. So being exposed to people who careers I wanted to emulate or were influential and helped me think about what I wanted to do. So one was an infectious disease physician, Dr. Mary Wilson, where I did my residency at Mount Auburn. And she was um, very interested in international health, and so that was an exposure that I had. Another was the opportunity to do research when I was a fellow at Massachusetts General Hospital, and that opened up my interest in epidemiology and studying infectious diseases. I got asked to be the program director for a nonprofit group called the International Society for Infectious Diseases in 1996. I was a young infectious disease doctor and researcher at the time. And to be honest, the main reason I agreed to take the job, in addition to still being a junior faculty member at Harvard, was that they offered to fly me to a conference in Hong Kong, and I had never been to Hong Kong, and I thought, wow, it'd be really cool to go to Hong Kong. And so in 1996, I got to go to Hong Kong, and that really fortuitously created opportunities for me to meet colleagues all around the world. And I ended up developing relationships with colleagues in Peru that led to a number of tuberculosis research programs that we did together, that got me to meet colleagues at the World Health Organization. And I got involved in working with the World Health Organization on surveillance of emerging diseases. Um, so that was really just a totally fortuitous opportunity that opened a lot of doors for me. And what I would recommend to you is when these kinds of things happen, where there's an opportunity where you wouldn't have necessarily thought about it and might take you in a different direction than you thought you might want to go, to seriously consider them, because you may find yourself in a very interesting place where you didn't anticipate that you would be.
Those are some really, really interesting experiences. I actually didn't like expect to hear about your experience in Hong Kong because I didn't see that when we did like your research on the background. And I'd also totally agree on like the importance of mentors because I've also met a lot of mentors that really helped me in um, my schoolwork.
Terrific.
And now we have some questions about your research and career. What is your current academic or career focus?
So I'm currently a professor of medicine and epidemiology, as I said. So I spend about 20% of my time actually involved in patient care, primarily in the hospital. So I work at a tertiary care facility, so I'm taking care of very sick, complex patients who have infectious diseases or who the other doctors aren't really sure what's going on and think maybe an infection could be involved. I do a little bit of outpatient care where I see patients in a clinic. Those patients obviously are not as sick as the ones in the hospital. Um, and they tend to have long-term infections, or they're referred to me because doctors aren't sure what's wrong with them and they think it might be an infection. So a lot of times my job is to figure out whether or not a patient actually has an infection. And sometimes they don't. It could be a cancer or some other problem that's causing their symptoms. In terms of research, my research primarily right now is focusing on tuberculosis issues. So one of the things we're working on is looking at using a technology called whole genome sequencing to uh, identify drug resistance in tuberculosis, meaning we're looking at the genome of the bacteria to help us pick the best possible treatments rather than growing the bacteria on a culture and then testing it against different medicines, which can take months to do with a a genome, you can sequence it and see right away whether or not the mutations associated with resistance are present or not. So it's a much more rapid way to figure out what are the right drugs. With my colleagues in Peru, we're looking at long-term outcomes of people who've been treated for tuberculosis. So most tuberculosis doctors think that, okay, you treat them for tuberculosis, they're cured, it's all done. But what we're learning is that tuberculosis can cause damage to the lungs. And even after you cure the infection, that lung damage is still present. And those patients don't do as well as people who've never had tuberculosis. So we're trying to understand how to better help people who have gotten cured of their tuberculosis, but still have health problems because of the lung damage caused by tuberculosis. And then the last area right now that I'm working on with a doctoral student is around long COVID and trying to find out what policies at a state level, for example, can help to reduce the risk of people getting long COVID.
That sounds like a lot of important work. And this is an add-on question, but how long has the tuberculosis research been going on?
So I've been doing tuberculosis research, boy, over 30 years. I published my first tuberculosis research paper probably in the early 90s, maybe around 1992 or so. So that would be about 33 years.
That's really impressive. For question 4, what does your typical workday look like?
Sure. So, depends a little bit on the day. So, days when I am on service in the hospital, I'm basically in the hospital all day. So I hit the hospital usually by 8 o'clock in the morning. I don't rarely get out of the hospital before 5 or 6 o'clock at night, and then often have to do charting and lab reviews and x-ray reviews later at night. When I get home, I can access all of the patient information on my computers from home. When I'm doing research, because my research is um, epidemiologic, I don't have a laboratory, so I don't go into a laboratory. A lot of what I do is on the computer or it's on site. So next month, in about 2 weeks or so, I'll actually be down in Peru to visit with my colleagues, and we'll meet and talk about the TB lung disease project that I mentioned. So when I'm not in the hospital or not in clinic, I'm often working from home because a lot of what I can do on my computer, so I can access it from any computer that has internet access.
Thank you for sharing. And for question 5, how do you choose which research problems to pursue, especially when global health needs are so vast?
Sure. So the most important thing for the kind of research that I do is talking with my colleagues about what's important to them. So, for example, a colleague, Dr. Eduardo Guttuso, who recently retired from Cayetano University in Lima, Peru, Eduardo and I have been talking for years about patients who've been treated for tuberculosis, but then not done well and even died. And he would say to me, Tim, we have these young people in their 20s and 30s, they get treated for tuberculosis, but they still die 5 to 10 years later. And even though it's not the tuberculosis is no longer around. And so that was the genesis for this project is so it's very important when you're working with colleagues internationally to understand what are the important issues for them and then to see see if you could work together on solving those problems. Another project we did years ago was a project the Ministry of Health in Peru wanted to introduce household contact tracing for tuberculosis patients. So what that means is that when a patient is identified with tuberculosis, you then you screen everybody else in the house to see if they have tuberculosis as well. That's something that we routinely do in countries like the United States, where tuberculosis case rates are very low and we have a lot of resources. Not typically done in countries like Peru, where case rates are much higher and they have much fewer resources. So we actually help them set up a program to evaluate that in a population of over 1 million people. And we helped design the study to figure out could they in fact do that and would it work? So that's a long way of saying understand what the issues and priorities of your partners are, and then see if you can come up with a project that helps to address those.
I think that's some really useful advice that can be applied to a lot of different areas too. And question six, as we did some research about what you've done like some of your work was related to responses to international diseases. So we were wondering what was a study or project you've worked on that significantly impacted policy or practice in global health.
So, a couple of things we've done. Um, One is a study we did where we looked at how do people recognize emerging outbreaks. And what we found was that most emerging outbreaks are actually recognized first by informal methods. So news medias, social media, things like that, rather than public health departments, for example. And so I think that was valuable in helping the World Health Organization and other public health organizations to realize that informal information sources could be very valuable in learning that outbreaks were occurring or starting to take off.
And next question. As someone who has held many prestigious academic and advisory positions, what are some of the biggest challenges you faced?
Sure. The biggest challenge is probably always around funding, trying to get money to support the different projects that you think are important. And, that's a competition. You have to convince funders and other people that that's what you want to study is worth studying. It can be difficult to build those relationships, especially if you're working internationally. But as I said, that opportunity to go to Hong Kong and to meet people through the International Society for Infectious Diseases really helped to jumpstart my career by creating opportunities for me to meet with colleagues all around the world and see if we could develop relationships. But building relationships can be a big challenge as well. Balancing work, family can be difficult. I'm fortunate. My wife is also a doctor. She's an MD, PhD. She's also an internationally recognized researcher, and so balancing two careers and making sure that we have time for our kids. That's part of it as well. But I've been very fortunate in my career, and I think and some of it's just luck, right? You just happen to meet the right people at the right time, and being prepared and taking advantage of that. But those are, I think, some of the challenges that we all face.
Yeah, I totally agree with that. And question 8, what kind of student would be a good fit for studying medicine or epidemiology?
Sure. I think for medicine, a key component is actually empathy and actually caring about other people and wanting to help other people. The science you can learn. Anybody can learn that. That's not difficult. And as I said, I was a history major in college, and it didn't prevent me from being successful in medicine. But I think caring about people, wanting to make a difference, wanting to help, those are very helpful for studying medicine. In terms of epidemiology, it's really helpful to like to problem solve, to be able to recognize a problem and say, gee, how can we figure this? How can we figure this out? Or why did that happen? Why did SARS happen in Guangdong province in the fall of 2002? What was it about that location and that time that allowed this new disease to spread first locally and then internationally? So epidemiology is all about asking why and going out and trying to solve a problem. So if you like to solve problems, then epidemiology is potentially a very good fit for you.
Thank you for sharing your opinion. Okay, so going on for question 9, Dr. Brewer, what advice would you give to high school students considering a career in global health?
So I think the most important thing you could do at the high school level is have an open mind to learn about different cultures, about different countries. Uh, just try to get some experience if you can, working in a different environment. But even if you can't get that experience, to take classes where you're exposed to different points of view and different frames of reference. So so generally expanding your willingness to be aware that not everybody approaches problems the same way. They don't view health necessarily in the same way. They might have different priorities. And how can you engage with them and learn from them and share your ideas in a way that's respectful and meaningful?
I think those are some pretty valuable viewpoints to consider as well. And we have our live Q&A. So for the attendees, if you have any questions for Dr. Brewer, you can send them in the chat and we can answer them. Okay, we have a question. Do you have any specific recommendations for the experience opportunities you just talked about?
So I think the most important recommendation is to be open to new opportunities. So as I said, I didn't plan to go into infectious diseases, and then I had the opportunity to go work at the Schweitzer Hospital in West Africa. I didn't I didn't plan to get involved in international health, and then I had the opportunity to participate in a international infectious disease meeting in Hong Kong and meet people from around the world. And so I think the single most important thing is just um, be open to new opportunities and don't be afraid to maybe try something different than you thought you were going to do.
Great. Another question is, what do you think are some notable differences in global health in the past and present?
So a big difference between global health now and international health and tropical medicine previously is, um, it was much more directed from the north, what's called the global north to the global south. So there are big power differentials and money differentials. And so people from high income countries like the United States would go to work in middle and low income countries and basically tell people this is what we're going to do and this is how we're going to help you. And that's not acceptable anymore. Nobody would do that. And so when I go to a new country, or even when I'm in Peru, for example, in a few weeks, um, the first thing I'm going to do is listen. I'm going to say what's important to you? What are you worried about? Um, what are the things you think to need to be addressed? And so rather than coming into a country or a situation and telling people, this is what we're going to do, this is how we're going to help you, it's really about listening and building collaborations and understanding what what uh, your colleagues need. Sorry about that. The dogs wanted to go out, but and then deciding whether or not you can help them, and you sometimes you can't, right? So I've been asked to be involved in projects. For example, I was asked to be involved in a nursing training project in Pakistan, and I really don't know. I'm a doctor. I'm not a nurse. I don't know about nursing training, so I didn't end up getting involved in that project. I think it's really important to understand um, where your limitations are too. And when you're working on these kinds of projects, make sure that you can actually deliver on what you say you're going to deliver.
Thank you for that response. Um, any more questions, anyone? Okay, if that's it, we can conclude for, oh, wait,
So it looks like there's one more.
there's
Would
one
you
more.
like to pursue any other career if given a chances back then? So, as I mentioned, I thought I was going to be an oncologist, a cancer doctor. I grew up in Connecticut, in a small town in Connecticut, and I thought that I would be a community place, community-based full-time clinician taking care of cancer patients. And, um, I think that still would have been a fine thing to do, but I ended up going on a totally different path. And so I have no regrets about the path that I took, but I think there are lots of other paths that could have been equally interesting and exciting.
Yeah, I mean, even if you took on today's path, I think you've achieved a lot of impressive experiences. And to conclude, we have our first edition of the Global Public Health and Health Equity Ethics magazine on our website that we just published. And you can check out our socials at our website, our Instagram, and email. And we are also looking for new members, so you can join as a team member in content editing, art, outreach, social media. We also have an AP toolbox, and we are looking for ambassadors. We have a blog or magazine that we accept submissions to have STEM articles published. And we also have a mailing list that delivers straight to your mailbox. On the right is a QR code to our link tree. And thank you to our partners for supporting us in hosting the yearly sessions. And thank you so much for joining us today, Dr. Brewer.
Well, thank you very much for having me, and it's really terrific that you're organizing these kinds of events, and good luck to all of you in your future careers.
Thank you so much. And feel free to join our next webinar planned in September on data science, which further information will be provided. Thank you so much. Bye. Have a good day.
Good night.